10 things you must know before getting pregnant. 1. Getting pregnant can happen a lot faster than you think. Even if you were planning to have a baby, holding that positive pregnancy test in your hands can still come as a shock. Doubts about whether it's the right time or the right age come up every time, but is there ever a perfect time to have a baby? 2. You'll feel your organs shift very early on. The uterus, which is usually tilted forwards or backwards, straightens due to its growth. This may cause slight discomfort or a pulling sensation in the lower abdomen. 3. You will get so tired sometimes. This is because your body has to produce extra hormones in pregnancy such as estrogen, progesterone and the pregnancy hormone HCG. This process contributes to morning sickness, but you will feel less sick after your first trimester. 4. Every time you pee, you will feel an intense need to check your underpants for blood stains. In the early stages of pregnancy, there is always a chance you might have a miscarriage. Between 10% and 20%, or as many as 1 in 4 known pregnancies, end in miscarriage, and that's perfectly natural. But even a light spotting of blood can be frightening. 5. Feeling sudden movement in your bowels at odd times during the day? It's tough telling the difference between a kick and flatulence when your baby is small, but you will fart a lot more, and a lot smellier, than you ever did before. The increased production of progesterone and estrogen reduces muscle tension and may lead to more gas in the intestine. Your growing uterus will also put pressure on the intestines, squeezing out every bit of gas. 6. Your hair will look amazing? It's true that some women glow during pregnancy. Increased hormone levels clear your skin and lead to more stable and longer hair growth. But once you give birth, your estrogen level drops, and after about 3 months, your hair can start falling out. 7. In pregnancy, you grow an additional organ. The placenta, which serves as a sustaining station for your baby, has finger-shaped branches that penetrate the tissue of your uterus to connect with the body via its veins and arteries. It provides the fetus with oxygen and all the nutrients it needs to grow, and can even produce its own hormones. 8. Babies do pee in the womb. The baby absorbs nutrients via its umbilical cord connected to the placenta, processing them and excreting the waste, such as urine, just as people after they've been born. But in the womb, a baby's pee has nowhere to go. So, the baby drinks or breathes it back in. 9. You'll have about 40% more blood in your body than usual. Towards the end of pregnancy, blood flow to the uterus increases tenfold, from 50 milliliters per minute to 500. And that's not the only thing growing with increased blood flow. Your nose can get bigger because of something called pregnancy rhinitis. 30% of pregnant women get it, but it's unclear how it is triggered. It may be that the hormonal change leads to a swelling of the mucous membranes. On the plus side, your sense of smell improves. 10. Your sex life may change dramatically. Your sex drive changes constantly in pregnancy due to hormones. Libido in the first few weeks is dampened by a knockout feeling, nausea and dizziness, but in the second trimester things can stabilize. In addition, fluids in your body will increase, such as around the vulva, the clitoral complex and various erectile tissues around the vaginal canal. Many pregnant women feel very lusty and easily aroused during this time.